and I are calling our fireside chat. So as Isabel mentioned, I'm Jodi Jacobson Frey. I'm a professor and chair at the School of Social Work, and I chair the Social Work in the Workplace and Employee Assistance Specialization. I'm honored to be here today with Tanya Bryant-Nickens, who is a licensed clinical social worker and a certified employee assistance professional who's worked in the field for over 12 years as a licensed therapist. And we both are proud alumni of the School of Social Work and have been working as clinical social workers in the broader world of work. If you'd like to take a look at our bios, please look at the email that was sent from the school that you had the registration link. So I did want to let everybody know today that we are recording this session. We would like to share this with other alumni and friends of the program who are not able to attend today. I also want to let you know for logistics, we're going to have a conversation for about 30 minutes, and then we have plenty of time for answering questions. So at the bottom of your Zoom page, you'll see a link for Q&A. Please feel free to ask your questions in the Q&A. We'll try to monitor that during our talk, and if there's a need for clarification, we'll try to respond. Otherwise, we'll respond to questions in the last 25 minutes of our hour. We will be putting resources into the chat, and we hope that you also will share resources with each other. So again, welcome everyone. I'm so glad that we're here together, albeit virtually, so that we can speak about how to support employees through trauma. As we all know, there's much trauma in the world today, and we think the role of social workers has never been more paramount, although Tanya and I might be a little biased on that. So before we jump into the meat of our topic today, I wanted to spend a couple minutes introducing and talking about the role of social workers in the workplace and employee assistance, just to have a starting point. Many of you know the majority of practitioners who work in the employee assistance field today are social workers. When we often think of employee assistance or EAP, we often think about individualized employee assessment, short-term counseling, and referral. But it's important to note that historically and present day, the field is actually much broader. In fact, employee assistance professionals and social workers particularly have been very involved over time in workplace culture assessment and response, management consultation and training, in addition to the critical support that we provide for individual employees and often their family members. I think this is an important starting place for us to consider as we talk today about the role of social work in the workplace from employee assistance and beyond, that we consider the micro to macro opportunities that we have as social workers to make a difference in the workplace, especially as we consider the assessment and response to workplace crisis and trauma. I'm going to actually put some resources in the chat if you'd like to learn more about the programming that we have both at the school and also the field of social work in the workplace employee assistance. Those resources include a link to the subspecialization page, as well as a link to the International Employee Assistance Digital Archive that I co-founded at the school as an open access free repository for anyone in the world to learn about the field, and also EPA, the Employee Assistance Professional Association, which we'll reference during our talk today as we talk about values, ethics, and standards of practice. So again, let's be sure that as we examine the assessment and the response to workplace trauma, that we look at the micro or clinical or from a public health social work perspective, the downstream approaches, but let's equally match them in thinking about the macro perspectives for assessment and intervention, or what I like to call the upstream approaches to prevention and early intervention. Social work in the workplace does include employee assistance, but it's much broader. And we think that many of you on the call today, while you may not identify as a social worker in the workplace, you probably actually are. So with that, hi, Tanya, how are you?
Hi, everyone. Thank you for joining us today.
So we're going to start off talking for a couple minutes about what is trauma in the workplace. I know when I started in the field, Tanya, it was very focused on individual crisis intervention and response. And we thought about traumas often in the workplace, they also had to be drama. they had to be dramatic to call in the social workers and for a response. And I know one of the things that we've learned in the field of workplace social work is that trauma doesn't have to be dramatic.
And it
And it
doesn't
really
have to be big and broad, right? It can also be
exactly
something that is cumulative over time. That could be something that affects either one person or a few people. And then overall, that productivity or lack thereof affects the entire workplace, right? So it doesn't have to be
agreed.
that broad macro space that we're looking at,
Yeah.
workplace violence, shootings at work, death on site. It doesn't have to be that large or that notable. So
I
what are you
think
seeing more now, Jody?
what do I see more? Well, I think right now I'm seeing trauma, in the workplace perspective as we look at the upstream approaches of thinking about the impact of um, job worker mismatch, job stressors, lack of resources to do one's job, like a real emphasis. The World Health Organization had recently named burnout, brought some increased attention to that to our field, but also thinking about the cumulative that you mentioned, the snubs, the slights, the harassment,
Microaggressions. Mhm.
microaggressions that accumulate over time and lead to some of the same outcomes that we see when there's a large incident or death or a natural disaster, that people, they're worn down over time, from what's happening in our more toxic work environments. And I'm starting to see a more attention to that, which I know is something we've talked about before. What are
Yeah.
you seeing, Tanya?
I'm seeing some of the same things. I'm seeing management sometimes lending to the workplace that has a culture of bullying. I'm seeing sometimes workers or employees being overworked or really not having the understanding of what their work is, ambiguity in the job. If it is something that goes on over a period of time, can be a workplace that is not, that becomes toxic, if you will. I'm seeing the place where during the murder of George Floyd, during that period when everyone sort of stood still, that workplaces were putting out statements that actually didn't ring true to employees, where they were saying there is no harassment or we don't tolerate this type of behavior. But in fact, those were the things we were seeing as social workers in the workplace and employees really feeling burned out because them not having a place to go to get that support. And I just wanted to say quickly, I see some questions starting to come in. If you all can remember to send it to the Q&A. So the chat is great because then you all can see what you're saying. But if you don't mind sending it to the Q&A, then Jodi and I can respond to those. And we're going to try to make sure we leave some time for you there. So these great questions are coming in already. Thanks so much.
That's great. I think, on the individual side, I'm also seeing greater attention to interest in evidence-based interventions in the workplace. I think for so long, it's been this black box of what happens behind the curtain of confidentiality, which, as a researcher in this field, it's been really challenging to say, what is it that is effective about the work we're doing that leads not only to improved worker mental health and well-being, but also workplace outcomes. And so I'm actually very excited to have, researchers and folks from outside of the employee assistance field starting to have conversations about, could we look at these evidence-based interventions and adapt them in EAPs or other workplace settings? Because I do think that, while the work we may mean well, but not everything that we do is helpful, especially in thinking about some populations that might be affected by trauma differently, especially Black and Brown employees that, as you mentioned, are seeing statements of performative action from their employer can actually have a more traumatizing effect on their well-being, just as much as employers that stayed silent. So I've been I think, encouraged, I would
Mhm.
say, by some of the resources and leaders that are looking not only at macro systemic level change that we'll talk about today, but also at that more individualized intervention to make sure what we're doing is culturally responsive and also evidence-based.
Yes. And how do we start there? I think for as social workers in the workplace, we want to be aware. We want to take sort of the temperature of the climate and know what does trauma look like. So just like you sort of gave a list of what that looks like, what are we seeing? What are some of the trends that we're seeing when they're coming into the office? If you are actually providing that counseling, if you are on teams that actually have responsibility for not only taking the assessment but helping to comfort and guide the community or the workplace community as they go through their changes, then it is our responsibility to be able to share that with the workplaces that we're in.
Definitely. So I'm thinking about like how our field is changing. We've just had rapid social change, environmental change, political change. I mean, every kind of change possible just in like the past week.
Yes.
But just thinking about trends over 2020 and what we're seeing in the field and how we've been responding to trauma. What are some things? I know your practice has really changed a lot. What are some things
Yes.
that you're doing differently and your colleagues?
Absolutely. So we're 100% on either telehealth for my practice or doing support for folks who are working in telework. So, as you know, federal employees call that sort of telework. And for those of us who normally are used to the face to face, so when we're doing workshops, when we're doing management consultation, when we're doing those things, normally it would be in the room, kind of hands on. Now we're doing that virtually. So we're using technology as our friend to help us still have the conversations and continue to manage the change that the workplaces are seeing now. So I actually love it. I love the telehealth. I do have my blue light glasses because too much on screen time can be, wreak havoc on the eyes. However, what we always do as social workers, we bring our presence, we bring our ethics, we bring who we are, to the space that we're working in. So what I've seen with the sort of telehealth, responding to critical incidences that happen in the workplace may be what they call the alternate duty station. So where you were able to find out about a death in person when people gather sort of at the water cooler in the morning, what you're finding is that people are hearing about it on social media or as they're texting and talking to other colleagues and coworkers. And then the social worker in the workplace is brought in to kind of gather the groups of individuals in whatever section or group or team that they're working in to give them the supports that they may need for those types of things. Even, to bring up the George Floyd incident, like you said, with the political issues, the kind of separation of the country, those are things that we are also trying to provide support within our ethics and our standards, of course. So it can be done, and we just always want to make sure that we're authentic to who we are and genuine to the work.
Yeah, I think the virtual has been really interesting. So being at the School of Social Work in the field of employee assistance, I've always pushed us to think about how to, really integrate this into our practice because we know EAPs have been doing this forever because
Mhm.
we support employees, all over the country and sometimes throughout the world. So I think it's been, there's definitely been challenges, but also I think there are some really interesting positive outcomes for working families. I've been chatting with a lot of employee assistance counselors who have gone virtual and are surprised to see some different populations that are accessing EAP that haven't been able to before, particularly those with dependent care needs, whether it be children or older adults. Because in the past, well, I guess, I am a parent, so that I will put myself in that category, but a lot of working parents and families and caregivers, they
Yes.
just didn't have time to access, getting alternative care support so they could go to counseling physically. And I think that has been one area that's been opened up where working parents and working caregivers are able to access some of the telehealth services like what you're offering because their loved ones can be at home. If they are privileged to be able to work from home as an employee, we're finding some increases there in reaching a different population that's really facing some stressors. So I'm hopeful like you that this will continue.
Yes.
I am excited for post-COVID life,
Right.
but I'm really also hoping that some of the innovation that we are applying more rapidly during this time will stick and will hold. So yeah, I think the technology has been real. I'll put something in the chat also. I don't know if you been using mental health apps at all. That also
I
keeps coming
have.
up.
I
Mhm.
actually use Simple Practice, so it's not a plug, you know.
Mhm.
I don't work for them, but for me it works well because it provides everything I need as a private practitioner. So it provides the billing, it provides the sort of conference space, it provides the video access, but there are also free things out there. So we're going to put those in the chat as well. Things like DoxyMe if
Mhm.
you're needing to communicate with folks. If you use Zoom like you're using today, you can have either free Zoom or you can, invest a little bit more in the paid Zoom. And
Mhm.
that'll allow you to have meetings with folks. You always want to make sure you're using a HIPAA compliant platform in some way. During the pandemic, just to be mindful, licensing boards, liability insurance, and you always want to contact the two if you have questions, about what services you're providing and is it appropriate or something that is approved to be HIPAA compliant. You basically can acknowledge you can find any HIPAA compliant platform, but other platforms that normally wouldn't be considered HIPAA compliant are actually able to be used during this period of state of emergency in the state
Mhm.
of Maryland. And also, just as a reminder, whenever you're providing clinical services, just keeping with our ethics, you always want to make sure that the clinical services are happening in the state that you are licensed in, or states. Some people are licensed in more than one state, just when
Yeah,
you're
the
going beyond that.
licensing questions continue to come up, and I know there's
Yeah.
been some flexibility with regulations
Mhm.
with COVID, and we have to keep an eye on them, how long they'll last and what it means.
Absolutely. And always ask the question. If you have a client who has to move or has to do the caretaking duties that we know about, something has changed in their lives, you want to follow them, just contact the licensing board for the state or jurisdiction in which they're moving, and they will give you the guidance for that. So you always have that support. So I'm seeing a lot of great questions coming in too.
Yeah, I just posted some resources about mental health apps. I think there's, been some fear in the social work profession and other counseling areas that these are going to replace us. And I think they actually can be a nice benefit to integrate into practice, but we need to learn about them. Just like any of this work, we have to do our own work as well. And so I see Dolly asked a question about really acknowledging the secondary trauma and being able to support ourselves and our staff, our own counselors. So I think actually the mental health apps are one way that we can learn about how to use them for our clients and actually see if they might help ourselves. And so there's a couple resources up there. But, Tanya, I want to talk a little bit also about there's something else in here. So we talked a little bit about the individual changes to practice and the integration of technology, but one area that maybe because of my role at the school, I'm getting calls from employers. And I feel like I've just been banging my head against the wall for 20 years in practice about how important mental health and well-being is in the workplace and how that links to productivity and performance and continuity, of production and of business. And now getting so many calls, what can we do? We need to do something. We want to do it, we're going to offer training to all of our employees. What can our EAP do better? And I think number one, I'm glad that they're reaching out to ask us what to do. And that it's risen to this priority area, even though it's because of a crisis. But I also think this is a really important time for social workers in the workplace to provide that immediate response, again, kind of the downstream crisis intervention, reactive, even meso level training, but to
Mhm.
push the needle a little bit in the workplace, that this is an opportune time to encourage workplaces to take a look in the mirror and understand if they want to support mental health and employees that are experiencing trauma, that they have to do some of their own work to recognize what parts of the workplace are contributing to trauma, like a toxic work environment, thinking about the murder of George Floyd and
Mhm.
the increased focus on racism in the workplace and systemic racism, thinking about other types of discrimination, oppression, harassment, and bullying, all the way to microaggressions over time. And I think this is a really important time for social workers in the workplace to use our value base, use our training and our view of the world that's a little bit different from perhaps other folks in business and workplace to push the envelope and really think about not only responding in the moment to the crisis, but going upstream to prevent the crisis from happening and changing systems. And
I'm
I
so
don't know if you're hearing some of that, but I'd love to hear thoughts on, how to bring this bigger picture.
I'm so glad you mentioned that, because one of the questions that you just mentioned talked about secondary trauma. And one of the things I think is most important is to be aware of our own secondary trauma that we may have around discussions about race. I think the understanding is that a social worker automatically has a different view. But the reality is we all individually bring our own biases, our own prejudices, hopefully not racism, but we bring our own prejudices and biases about anything and everything. And so, as much as possible, just like we focus on self-care, we also want to focus on doing the work. So, what I have done personally, in my own practice, is I will not send an individual who is a victim, if you will, or a survivor of racial trauma, specifically racial violence, but racial trauma and oppression, to someone who is not doing the work of anti-racism. So, Jodi, I may be sort of jumping ahead a little bit, but you did an actual very informative article for any social workers in the workplace. And it talked about when you're out group. So if you're not a Black and an indigenous person of color, that you want to be more than just someone who sort of operates on the fringes as a social worker, right? You want to be more of an ally. And so how are we able to be allies in groups with which we don't belong or in which we don't belong? So say for LGBTQ and individuals, I actually try to, as much as possible, educate myself, be aware of my own ignorance when it comes to whatever may arise. I try to, as much as possible, be open to learning, to actually taking credited courses, right, from approved instructors, not just a random workshop, but to actually do the work. And so when we're thinking about race and gender oppression, we're also thinking about noticing the importance of being trained so that we feel comfortable. It's similar to faith. When you're not comfortable for where you stand, it's hard to meet the individual and let alone to inform the workplace as a social worker in the workplace about the changes that need to sort of occur in that space.
Yeah, I think, yeah, it's perfect timing, Tanya. So, I mean, I think this is where we want to get to. And I was putting some resources in
Oh,
there. I'm
good.
also going to link last month, some of you may have attended Shauna Murray Brown's talk on becoming more anti-racist and liberation focused. And there's a link to her website where she's doing just outstanding
Great
training
work.
for clinicians and leaders in the workplace that I would recommend. But I would get calls from employers, which was
Mhm.
like this exciting opportunity to push them because that's just what I do. And I said, well, if you're going to talk to me as a social worker, we're going to, talk about your policies, your healthcare access, your mental health parity. We're going to look at issues about hazard pay for your frontline emergency essential workers. And we're going to think about trauma and grief during this time of COVID, multiple pandemics of racism, environmental crises, and how that's affecting low to moderate income employees and also Black and Brown employees. Like these are topics that you may not have called me for, but you're going to get them. And, it's a mix. Sometimes I find there are some more progressive or open-minded folks in leadership positions that are ready to listen and start acting. And sometimes, we've got more work to do, let's say.
Mm.
Um, But, really interesting about doing your own work is very critical because I also had a lot of employee assistance professionals and social workers call me, especially during the summer, and
Yeah.
they were getting calls from the workplaces they supported, particularly managers saying, please come do a racial healing group. Please come talk to our manager. They don't know what to say and they're worried they're going to say the wrong thing. And their employees are upset about racial injustice in the
Mhm.
community and in the workplace.
Right.
And some of our social work peers, they didn't know what to do. They were paralyzed in fear of saying the wrong thing.
Mhm.
And I was almost taken aback a little bit, but not very surprised. Because I'm thinking, here we are, social workers in the workplace. We are trained to help folks in going through organizational change. We are trained to consult with managers on how to be effective leaders in difficult times and talking about crisis and trauma. And yet, when it comes to racial injustice, we're frozen.
Yeah.
So what is that about? I think, again, as a white clinical social worker, like if I find myself in that position, I need to check out that maybe I haven't done my own work. And the same thing with other areas of oppression, like you mentioned. In order for us to be effective with both our who's sitting in front of us as a
Yeah.
client, but also that client as the workplace, we have to be, as comfortable as we can and continue to push ourselves in our learning and exploration to then help guide others. And so that when I'm able to have those conversations with very seasoned folks in our
Mhm.
field, I've been really encouraged to see many of them have invested and hired folks to help build their capability in their EAP, in their counseling program, and then also building it in the workplace. So again, it kind of brings this pivotal time of from crisis can come growth. And while we have continued challenges, and I know we'll get to some of these questions in a minute,
Yeah.
I think it's an interesting time for social workers to be in the workplace where we do have a voice that some more folks than in the past are listening to.
Yeah,
So.
and just to be mindful, we want to be having these critical conversations not during a just during a time of crises, but
Mhm.
also during a time when we are, we're at the point where we're trying to learn more. We're trying to do more. And we have the luxury, if you will, of the time and the space to do our own personal growth. Even in private practice, or if you're working specifically with contracts, you're not quote unquote on site at the workplace, you can still have a voice there as a social worker. We want to be mindful, just what Jodi said. If you're seeing a pattern of referrals, I often get mandatory referrals, right? And we know EAP is voluntary, but when they say mandated, they actually mean it's part of their policy that if certain actions occur, that they will send this said employee to an EAP provider. And so oftentimes I have several contracts where I see that. You know why I love mandated referrals? Because oftentimes it's not about the work. It's not about the job itself. They love the job. It's about these same things that we're talking about, not feeling supported in the workplace. If I see a pattern of these things, these are the things that I'm able to give to the contracting company, who then can also give that to the particular companies or organizations that they serve. So we always have a voice at every level. So I think it's great, Jodi. That's a great segue. Maybe we can start to get into some of these questions when you're
Yeah.
ready. Mhm.
So as before we get into the questions, I'm just wondering from your perspective, like, what do you think some next steps are?
For the social workplace, social work in the workplace, I'll say. So
Mhm.
I would say, for as an alum who does the work, as someone who, before I was even in social work school, was a friend of social work, but was very interested, like you said, of evidence-based practices that could help people in the workplace. What, how can we support the work of those who come behind us and who are continually training to do this work and provide this support in the workplace as we change our environment here?
Well, as a fellow alum, I appreciate that question of thinking about how to keep the field going. And I just want to take a minute, Tanya, to personally thank you. You have been one of the most involved alumni that I know, and I just really appreciate you, as do so many of our current students that you mentor, recent graduates, and all that you do for the field. So I just want to
Oh,
thank
thank
you
you for
for
saying
your
that.
support.
It's
'Cause
my
that's
pleasure. It's my pleasure.
it's really, that's just an example of how to support this work. It's ever changing, which to me is very exciting, actually. That I enjoy, seeing what's next in the workplace, and how can
Mhm.
social workers make a difference in that bigger field. But I think for ways that both alumni and friends of the program, supporters of social workers in the workplace and employee assistants can be involved, is through the mentoring, through the peer consultation and coaching, to really help with that
Yeah.
secondary trauma when we might be the only social worker in a workplace and not have a supervisor or a confidential person to talk to. Providing internships for students. By the way, I'm advising
Absolutely.
students now for fall of 2021. So there's a great opportunities to work with our students clinically and macro. And also, I wanted to let folks know about the Social Work in the Workplace and Employee Assistance Fund, which is from our University of Maryland, Baltimore Foundation. I started this fund last year as a way to support students. We are all struggling financially. It's a tough time to give, but our students are also really struggling to try to get this education and
Mhm.
experience, particularly during a time of a pandemic. And so I'm working to raise $50,000 to create an endowed scholarship for students, that will not only help to pay, to offload some expenses for students that want to go into this field, but also to support some of the projects that we do, like the International Digital Archive, that's just kind of a labor of love that I do, and other small research projects and opportunities. So again, I know it's a really challenging time to give, but if you are able to make a donation, I know we'll send information about an incredible match that the university is
Yeah.
doing right now for new donors and existing donors. So I'll put the link in the chat for anyone that wants to take a look at the website about the fund, and there are all different ways to get involved. Like we talked about, mentoring, internships, peer consultation, and they're all really needed.
Yeah.
So so
And just
let's
a
move
brief
into.
word,
Oh
just a
yeah, go
brief
ahead.
word about what the students look like. So oftentimes we think of grad students as someone who has worked maybe somewhere and then they stop their work to do the education. But what our grad students mostly look like are sometimes full-time employees. And when you're working, it's really tough to do this work. But when you don't have enough money, it's really tough. And I recall a brief period when one night when I was in grad school, and a woman who was a nurse and shock trauma saw me in the elevator, and I was coming from my job, and I was so exhausted, and I had a class from 6 to 9. And she said, "You know what? Keep your head up." She said, "You will persevere." She said, "Oftentimes we have to work to get to what is our calling." And she said, "You are on the right path." She didn't know where I was going. And so I felt like that spoke to me. So as Jodi said, it's our responsibility, especially if we've done this, to try to help those who are coming behind us to do this work. So
Great.
thanks for that moment.
So
Yeah.
believe it or not, Tanya, we're like exactly at 25 minutes to
Oh,
have
great.
questions. I
Great.
couldn't believe, I tried to build in some cushion, thinking we might go over. So as a reminder, please do write questions in the Q&A. We're able to see them, as well as the folks behind the scenes that are helping us monitor the questions. So we'll try to answer some of those, and also to provide resources in the chat. We know that the participants here, there's over 60 people on the call, that you have lots of resources to share. So please feel free to do that. So I see our first question is from Dolly Clayton. This is really important. I think ultimately it's trauma related. We're dealing with COVID, resources are limited, having to offer reusable,
Mm,
washable PPE masks, staff preferring to use disposable paper masks and wanting to support them to feel safe, but we
yeah.
don't have unlimited resources to support an infinite disposable PPE. How can I communicate that I care for them and their feelings of safety, and yet encourage them to make the effort of good stewardship and washing and reusing? That's That's a great
That's a great
question.
question.
This came up also with a student I was working with in their internship, and where they were doing intakes, and there wasn't enough PPE for the social workers. So we hear that a lot.
All of the time. Yeah.
And when we talked about trauma and being related to burnout and lack of resources to do our job, these are factors that are system wide that do contribute to trauma. And so one of the things, that we did was think about, like, what is a requirement there at that setting, and were there ways to invest in safe space development that may be more permanent, like a screen, as compared to PPE, or having both. And then actually I went into advocacy mode, and said, we need to, like, look at our resources here. This was, through the University of Maryland. We had the School of Nursing doing a making campaign, and could we access that for some of our community programs and folks that are on
Great
the
idea.
front line in all different settings, including counseling and social work, that need to access PPE. So I think, Dolly, you had a couple questions up there. But I think it's really important, just like we have to do the work if we're going to try to advise workplaces to be more anti-racist, to be more anti-oppressive. We also have to do the work for our self-care.
Yeah.
And who was it? Maslow's hierarchy of need. Like,
Needs.
we
Hmm.
need to focus on safety and security in our job at the utmost before we can be doing the higher level work. So I think, as much as we can think about how our employees are safe and protecting them, they have to be safe. They have to be fully present and aware in order to do this highly traumatizing work. That was kind of round and round. I don't have a great answer,
That was
but
a great answer. And also being mindful of what compassion and empathy you carry. So how you present and how you support your staff is likely going to be genuine to who you are and who you bring to the table. So I'm
Mhm.
sure your staff would be, very well supported, or know that you support them based on how you communicate with them. Also, the other thing is advocacy. Just like Jodi said, there are other ways that you can sort of, fill the need of the PPE. You also can serve as a voice for advocacy in the state. Be mindful that the state legislature starts in January, and they're a little bit later this year. I think it's 13th or the 15th is their first meeting. They're going to be virtual. You can be a voice with your elected official, or anyone who is putting forth, more requests for PPE. The Social Workers Unraveling Racism, which is a committee of the National Association of Social Work in Maryland, also had a petition on change.org, and we were asking for more PPE. So be mindful of those types of things. You always can put the question out there with other social work groups, and likely there's someone who is doing the same thing that you're trying to do. So thank you for your question.
Really glad you brought up policy, because a lot of times when I work with students that are going to this field, they feel like, how can I be an advocate and a change agent, especially if I'm working in a somewhat oppressive workplace? And how do I feed that, perhaps in the community? I just put up a link for the Cash Campaign of Maryland that we work really closely with, that does a lot of advocacy for issues about equal pay and workers' rights, in addition to a lot of other financial capability and asset building. But I
Wonderful.
think, in addition to the PPE advocacy, we also need to think about paid sick leave. And
Yes.
when you're when you're doing policy advocacy, one of the things that we often need last minute are people to tell their stories. And this group here might be a room full of storytellers, to talk about what it's like trying to provide services and to support staff, whether it be social worker, or I see non-licensed mental health direct support staff,
Yes.
to be safe, and thinking about financial well-being. So, we talked about
Living
toxic
wage.
work environment, but a lot of people can't leave their workplace. That is not an option for many people. And so,
Yes.
if you're, in this place, yes, counseling and therapy is very important, to have a safe, confidential place to explore this and think about options, but also advocating for paid leave. Particularly with COVID, I see employers are not paying for the quarantine time. And
Yes.
so I'm very lucky. I'm very privileged. If I have to quarantine, I can teach here at home. I can do these Zoom meetings. But folks that are in manufacturing, service, healthcare, they don't have the luxury of working from home. And then employers are not necessarily paying for quarantine time. So what does that mean? If I need to put food on my table, if I need to keep the lights on, then I have to make a potential deadly decision if I go to work knowing that I'm exposed, or do I leave without pay? And so I think that's going to also be another area for us as social workers in the workplace to really pay attention to, and any voice that we have with employers to push that from a public health safety perspective, in addition to the productivity and their bottom line. If that's,
Yes,
what makes sense to the employer to listen to, we have to make those connections for them between health, mental health, well-being, and productivity.
exactly.
Anyway, off my soapbox. What other questions do we have?
So, how Jessica Robinson said, how can we support social workers who are essential employees and have been going to work during COVID? What's the role of social workers in advocating for non-licensed mental health direct support staff? Which is interesting. You just mentioned that.
Well, yeah, I think social workers in the workplace have to look at the full workplace,
Yeah.
and particularly working individuals and families that are going to be hit harder through lack of access to health, lack of access to financial means, to the ability to be at home and to quarantine. If you've got multiple families living in your home, like these are not options. So I think now more than ever, the values of our code of ethics, that's been ingrained in us, we have to use our voice in different settings to not only advocate for ourselves, but also for other folks in the workplace that may not have, um, as loud a voice. So,
Exactly.
do you have other ideas, Tanya, or should we
I was going to say
go
the
to the
same thing
questions?
when we talk about our values and our code of ethics, to understand that we always bring that with us. And when we approach every situation with those in mind, people know who they're getting when they come to us and ask us the question.
So let's see.
Dan Jones, it looks
What
like.
else do we have?
Dan
So,
Jones in
oh yeah,
general.
I think Dan had to leave,
Oh, he did. Oh,
but he did ask a question here
okay.
about providing services on a macro scale. And hopefully that's something that came across today. Is historically social workers in the workplace have always done that kind of work, and many of them continue to do that work in EAPs and other social work in the workplace, positions. But I think we have to do that work. I really think, that whole person and environment that you learn on day one, we have to see the environment as the workplace and the society and community that surrounds the workplace, to be able to not only help the person sitting in front of us, but also think about more upstream approaches to change the systems that cause the problems in the first place. And I'm not saying that like it's easy and we're going to flip the switch. It's an iterative process. I've certainly had probably more barriers than successes, but we have to continue to push forward. I do
Yeah,
think.
I was going to say we don't give up there.
Yeah.
Yeah.
So how do we
Mm.
proactively implement mental health services in the workplace to prevent burnout? Person writing is part of, oh wait, it says,
I may be
oh, okay. I'm trying to
somewhere
follow the
different.
chat discussion.
Oh, I think I may be
There it is.
somewhere different. I see Megan Healy. Yeah, that's what you had.
Oh,
Mental
yeah,
health
that's where I am,
services in the
Megan.
workplace. Yeah, yeah.
And then
Okay.
being
So
in
we,
a public school, working on a school-wide support for teachers and staff. So I do think in terms of implementing mental health, that again, right now there seems to be this pressing crisis need to do something.
yeah,
And we should seize that opportunity to provide immediate support through like an employee assistance program, or if you don't have a program, looking into one, or a community mental health program that can understand the culture of your workplace and be able to provide support, but also using it as a way to build perhaps an advisory board at the workplace to
Yeah.
inform leaders about emerging trends and threats and solutions. It's a very cost-effective way to keep your finger on the pulse of what's happening over time. As we're in this COVID response for the long term, we've had some shifts. In the archive, we were posting tip sheets on like changing to a remote workplace, and then
Yeah.
continued isolation and connectiveness, and thinking about return to the physical workplace for folks that were coming back that had been off. Like, we go through phases. And so I think there are some very cost effective things that we can do as social workers in the workplace to stay informed and to build those additional allies that we need in leadership positions to communicate messages of health and well-being, to invest resources. Um, there's nothing, I love employee resource and affinity groups to provide spaces, but they need to have budgets.
Yeah.
So, I mean, to really, like, as going back to the performative statements, Tanya, that you mentioned
Mhm.
earlier, we have to put some resources behind them. Otherwise, they're more damaging and more
Yeah.
traumatizing to say, we don't do this, we don't support this, when in actuality, that is
You do.
what's happening.
Yeah.
Yeah.
Well, and also being mindful of the work-life integration. So
Yes.
bringing them in to do the things that they are trained and that they are expert in. So other things that social workers also might know, mindfulness. You don't only have to have a workshop on diversity, right? You don't only have to have a workshop on workplace or racial trauma. You can also have a space like a workshop or a space that just gives you some time to talk about how to detach, right? So when you're virtual, maybe the workplace or the work itself lasts longer than it did when you were at a workplace and you had to leave to pick up your children or commune with your family or start dinner or go to a sporting event or do whatever we did when we actually had a life, right? So understanding that we still have a life, it just is tailored a little bit different now. And so how can we make sure that this awareness is something that is consistent, not just when people are suffering, but throughout. So maybe every quarter, every whatever,
Mhm.
you're having space at time where employees can come together and actually have that space to let some of the stress and some of the worry that they have related to this pandemic, kind of let it go. So thanks
Yeah,
for asking
I
that.
love that you used the term work-life integration and not work-life
Yeah.
balance. I've
Yeah,
been
I think that was
really
the buzzword for a while.
yes, and it was like a toxic buzzword. I feel like I was always a non-achiever. Um,
Because the
but I
work was on
think
us, right?
the work was on not, and
Yeah,
that's where
yeah.
I feel like the integration is actually more balanced, for lack of a better word, because it recognizes what we bring into work and what we take out, even with the blurred boundaries of a lot of remote work and a
Yeah.
lot of frontline workers that have blurred times and longer work hours, that we're really forced to take a look at that
Yeah,
integration. And actually employees want integration. They don't
they
want
do.
to leave one at the door and come in. So I think how you're thinking about technology to have those conversations, to build rapport and to build relationship in the workplace is really important, even though it looks different.
Yeah.
I saw a question here from Elisa Medina about successes to reduce stigma. I'm actually going to put a resource. I don't have time to talk about it, but I think the school wants me to do a presentation on this in the spring. Um, but let's see if I can make that work.
I just want to validate what Lisa said further on. So she was saying at a place where she works, there is quite a bit of stigma among the employees and leadership. And it's not just there, it's likely
Right.
all workplaces. I had a woman come into an office and she was kind of cloak and dagger, like looking up and down the hall to see if anyone saw where she was. One way that you can do that is that you're offering services not just for those who are seeking specifically the short-term solution-focused counseling. When you offer, or you're the person who is working and collaborating with the wellness program, within your either your organization or your company, then people know who you are. So it's not just problem based, it's more of solution based. It's also understanding that you can help with anything. It could be financial, it could be undiagnosed mental illness or mental diagnoses. It could be school related, it could be family related, it could be caregiving related. So those are things that touch everyone. And most places I've ever been, when you talk about caregiving, so when you have an expert come in, and talk about that, when you have an expert come in and talk about adoption, when you have an expert come in and talk about long-term care, those are things that hit everyone. Finances, what's new with the tax, whatever. If you have that ability, it makes it more of a global program and not just, oh, well, that's where people go when they have a problem with mental health, or that's when people go, where people go when they have a problem with discipline. So it just, it showcases what EAP actually is, and it gives you that presence that makes everyone more comfortable.
I put in, I totally agree with you about being able to couch this in areas that open up doors for conversation and resources.
Mhm.
I put in an example from the national guidelines on workplace suicide prevention that I helped to create and have been promoting. And it really does a nice job lining up guiding principles that any work organization or professional organization can take to do both the upstream, so the working on toxic work environment, looking at policies and programs, but informing leaders how to lead with compassion, getting the communication messages out the right way to help break down stigma, and again, open doors to accessing help both in times of crisis, but also before. And then thinking about the meso level interventions like training, peer support, gatekeeper, types of interventions for the workplace, all the way to the crisis intervention and what to do after there's been in this case, a suicide. But it really, the practices that are in the guidelines are for all different types of crises. And I think they have been very successful. To take a more comprehensive model is going to help to reduce stigma, or actually what we're starting to call discrimination. We're
Yeah.
in the process of kind of changing that language, because what is it about mental health particularly that is stigmatized is that we don't talk about that with health conditions.
Yeah.
So is it really more of a form of discrimination, which again pushes us as social workers, I think, to get to the workplace leaders that are going to be able to change those policies to reduce the barriers that are discriminatory for accessing care. And the
And just
other
to be
resource.
mindful.
Oh
Oh,
yeah,
I'm
go
sorry, go
ahead.
ahead. I was
I was
just
just
going to
going to
say,
put
just to
one
be
more.
mindful of our time.
Oh
So
yeah.
Jodi and I
Thank
get
you.
together, or Dr. Frey, and we actually will chat all day. So
We
we
could.
love EAP and we
We
love
could.
social work in the workplace.
We
And just to be
could.
mindful of the questions we weren't able to answer, that you can either send those through the school, and you will be getting a follow-up email. And Jodi, either you or Isabel can kind of give us that guidance
Yeah,
for
and
what people
I'm
can
gonna also, I don't know if you want to share your email, but I'll share them with you. I'll put it in the chat,
in the
some
chat.
ways
Yeah.
to also connect with me, whether it be email or social media, Facebook, Twitter, and LinkedIn. But I did put one resource on there that I think answers a couple questions. This is the CEO Roundtable from the American Heart Association, and we did an expert panel pre-COVID. But in thinking about reducing stigma and encouraging mental health and well-being. And one thing that I really liked about that group was not only that it took a combination of reactive, more downstream and upstream approaches, but it actually carved out what you could do as a small, medium, and large organization. Because that's something we haven't talked about, inequities in work organizations. And a lot of large employers can have more robust benefits to offer their employees, whereas smaller employers often feel that cost prohibitiveness and not being able to do anything. And so one thing I like about the Heart Association's approach is that there are solutions for all different sized employers and resourced employers. So as we're thinking about, like, our budgets are being cut and we have to do more. There are things like the advisory board, like the affinity groups, like the storytelling with our leaders that really don't cost anything that we can do to make a big difference in supporting employees that are facing trauma every day, both from the community, from COVID, from multiple pandemics with racism, and also at times from our workplaces. So I want to just say thank you, Tanya, for joining us today.
Absolutely.
I wish we had more time during our workday to just talk about these things. And
Yeah,
I want to say thank you to everybody on the call today. Wonderful questions, great resources. We will try to respond to more of the questions offline. And I would encourage you to get involved, to email, connect with the school, with all of us, and stay involved in this discussion. If we have it in another week, we'll probably have more things that we need to talk about the way that trauma has been evolving. And I encourage everyone to get involved with the students. Again, if you can do a donation of any size to the fund, I would greatly appreciate it, as would they. But also think about ways to connect back through mentoring, internships, and other support.
and be
So
mindful that it makes the EAP group look good. Because when I was on the alumni board and the alumni president, I would personally call EAP and social workers in the workplace, so that we could beat everyone else in giving. So we ask that you help us do that.
I love it. A little friendly
Little
competition,
competition.
Tanya.
Yeah.
Love it. Well, thank you again, everyone. And thanks to Isabel Garcia and Krishna Williams and Shantae Hatcher and everyone at the School of Social Work for helping us to put this on. I wish you well. Be safe, everybody. Take care.
Take care.